We are now recording. Hi, I'm Janet Gillo, Director of Professional Development for the Brown School, and welcome to Open Classroom. We are so delighted to have you here joining us. We are recording, broadcasting as well on YouTube. For our folks on Zoom, we cannot hear you or see you, but we welcome your interaction, your questions, your comments. Please throw them in the chat. And as there is opportunity, Gary Parker, our Associate Dean for External Affairs, and I will be fielding them to our speaker today. So one of the best, probably the single best thing about the Brown School community is its people. They are bright, heartfelt, authentic, unexpected. And our speaker today is not somebody that I've had the privilege of knowing until we've got to work together on this project. But I can already tell you all of these things are true of Ian Forber-Pratt. He's a 2009 alum of the school, a member of our adjunct faculty. But I'm mostly going to let him self-introduce because his life, his own story leads into what allows him to give the presentation he's sharing with us today, which is integration and reunification of children to families. So with that, welcome, Ian.
All right, Janet and Gary and everybody, thank you so much. I'm grateful to be here with you today. And I would like to start with a bit of the reason that I am here in front of you, which is this kind of lived experience. So actually this presentation in the next 35 minutes is going to be very practice-based. I'll present a little bit of research, but it's more kind of on the ground globally, how you hopefully can have another tool in your toolkit for how families and children can reunify when they've been separated. That's the main goal, and we'll get into a couple more goals moving forward. But as a quick introduction to myself, I'm adopted from India, was raised in the United States, so that's why I look like this, but sound like this. And I was lucky enough to be a graduate of the Brown School and did direct practice work for many years until I moved to India and moved towards kind of the administration side and the social change side and the policy influence side of social work. I feel unbelievably lucky that I've been able to be part of all of those buckets of contributing to society, which has been great. And it's been, I don't know how, but 15 years that I've been doing this work. So I am hoping to bring a lot of those lessons learned in front of you all today. So right now I wear three caps or three hats. I work globally with an organization called CIRI as the Director of Global Advocacy. I'm the Executive Director of a St. Louis-based organization that's doing some scaling and replication of evidence-based programs. And then I am lucky enough to be an adjunct faculty member at the Brown School. Now, the little clipping that you see on the right there, I just thought it was really important to share that myself as an adoptee from India, I was never reunified or reintegrated with my family. Now, I believe I'm one of the lucky ones. I've had quite a privileged life and I'm able to give back in many ways. But as I go on and move forward, I'll talk a little bit about the evidence that says that in general, big picture, children are best with their culture of origin and best when they are able to be raised by their people and their communities. So I'm going to section this into three parts. I'm going to define reintegration and reunification and give you a quick case study. And actually, I'm starting with a fail as a case study that didn't work out. And I know that's a little bit weird, but I want to kind of challenge you to challenge me. And then I'm going to talk a little bit about systems change and what's happening in the world, and then get into on the ground a practice model that I hope you can take and kind of weave into the way that you work with children and families, or that you influence systems that work with children and families. So basically, as I mentioned, I want to challenge you. I'm going to put some tough questions in front of you. I would love critical feedback, questions in the chat box, etc. I'd like to share kind of these big pieces of global reform. And then I'm hoping that you want to know more afterwards. My email address is at the bottom of each slide. And also this entire presentation will be provided to you. It is very text heavy, so I'm going to summarize a lot of slides. but it's meant so that this can stand alone without me later on, should it need to be. Okay, so here we go, part one. And I'm gonna try to get through this as quickly as possible because there's so much to talk about. So when you hear reunification and reintegration, they sound somewhat similar, at least to my ears. But if you look at the second definition there, reunification is more kind of the physical, a child has been separated from their family or their community, and they are physically put back into that family or community. And the intention is permanency, but they're just kind of plopped in. And what's happened with a lot of systems is that children have been reunified with their families, but they don't have the services. Sometimes that original reason that they had to leave their family setup isn't fixed. So they're back to the same thing, and we wonder why then they bounce back into the system very shortly afterwards. Reintegration is when you're actually looking at that child's long-term needs. You're really diving deep into how do you wrap services around them. And the practice model that I show you today, Active Family Solutions, is going to outline exactly how that can look. And if you see on the right in the little tilted text there, what I've found is that bureaucratic systems are set up to get children back into families, but it takes the people, the case managers, the teachers, the nurses, the healthcare professionals to actually then wrap these services around so that children you don't just put them back with their family and say, all right, good luck. We hope everything's okay. So I'd like to start with this kind of failed case study and really challenge you to think of, do you even believe that reintegration and reunification is the right thing for children? I believe that it is, but I'm going to give some caveats later on. So basically this case study, I'll breeze through really quickly. You see a couple there and two children. And this is an India-based case study where we were working with a community partner. And that community partner found out that this couple had relinquished their children. They had left them at a hospital when the second child was born. So the big picture is the mother and father were HIV positive and had a lot of health issues. And they had the first son, and then once the second son was born, they said, we can't do this. We cannot raise our children. They left the children, both of them, at the hospital and went to go commit suicide on the railway tracks. Now, I apologize to anyone that this feels like a trigger, but this is the real story. The police intervened, luckily, they survived. And the children were transferred to this community partner that we were working with. And the community partner at that point was thinking, what are we doing having children in these institutionalized setups? If children can go back to their family with support, we should do that. So they reached out to this couple and said, what's going on? What do you need? What happened? The couple said, we've got nothing. We're deflated. We have no hope, etc. So they wrapped around a lot of services to this couple, and they were able to eventually take these two children back. And when I show you the practice model later, we'll talk about all those things that they could have or did do. But then, unfortunately, the woman, not unfortunately that she became pregnant again, but she had a third child, and the man started drinking, substance abuse came back, all of those problems started coming back. And by that time, the community partner had stepped back a little bit, and before you knew it, they were in a government orphanage and separated. Right now, the current situation is the two youngest children are going for adoption together, and the older child has been separated and is with the community partner. Now, the reason I outline that to you is that not every case is going to be perfect. And this community partner did absolutely brilliant work, and still this is the outcome. And in social work, a lot of times there's going to be heartbreaking things. But you'll see at the end of this presentation, this is what I believe an outlier. There will be cases that fail because we're working with human beings, but there is so much good to be done, and I'm planning on proving that case as we move forward. Okay, so let's talk about systems and what's actually happening in the world right now. Basically, I'm going to skip that. That'll be for people to take a look at later. Basically, right now, for a majority of the globe, The left side visual is how children are cared and protected for. So you see that gray box, that's children that are not served, not receiving any type of services. And at the top of that pyramid is children put into orphanages, left there, they turn 18, and then we don't know where they go. And then under that, you've got some adoption, some sponsorship, and at the very last piece, you've got family type of stuff, kinship care, foster care, family preservation, keeping families together. And it's ironic because many places in the globe, the informal way that kids are cared for is always with their families and their communities. So what the globe is trying to do is move to the right side graphic, where basically you've got that family-based care and supporting communities, especially communities of origin, as the predominant way of care and protection of children. And then less and less and less and less and less until you get to institutionalization at the bottom. And hopefully a drastic reduction in the children that are not served, so that we're bringing more and more children into the catchment area. Now, this is how I think it's going. So basically the curve there is based on the diffusion of innovation theory, and there's a citation below. The bigger squiggly line is something that I've overlaid from work that I've done in policy around the world. I'm going to use the US as an example right now. So basically, as countries or states move from we're putting children into orphanages to we are providing them a wide range of services, and starting with families and communities, you're going to have innovators that are like, okay, this is a fantastic idea, let's do this. And then you'll have early adopters that say, okay, we've been convinced, we've been working hard on the ground, this is great. And then you hit a chasm. And in that chasm, it's really tough to push everything through to your early majority of people that are going to take up this new way of practice. And it's not that people don't have good hearts. It's that a big system is set up in a different way. Remove a child, put a child into a home, and that's it. In the US, we did that a number of years ago, where we moved from big institutions and orphanages, like in New York City, et cetera, to a system that's predominantly foster care these days. Now, with a new legislation in 2018 called the Families First Act, the US is doing the second iteration of deinstitutionalization and moving from foster care as the predominant way of care and protection towards communities, prevention, and helping families at risk so children never have to come into the child protection system. Now, what I've seen globally, if you look at that squiggly line, is that you have some policy change that happens, but the ground workers and a lot of people just aren't bought in yet. So they're told, hey, you've got to change from institutions to family, or foster care to family preservation, but they're not there yet. So then this chasm happens of social change. They're not there yet. And unfortunately, children's outcomes have the potential of decreasing or being harmed during this transition. After that, buy-in starts coming because people start seeing the benefits of a child with their family. And they also see what happens when a child is just dropped off with their family with no supports. And then you get a second round of policy change, and eventually a third round of policy change where more and more people come along. So I could go into that in more depth. I'm happy to talk to people. Diffusion of innovation theory is fascinating, but I thought I'd put that out in front of you. Now, the takeaway message here is that deinstitutionalization, moving children, the system towards taking care of families, reintegrating families, is evidence-based. It is how children thrive the best. When you look at brain development of children that lived in institutions, it's far less than children that grew up in a community and a family. And there are many arguments, but with a caution. What we've seen around the world is people get rah and excited about reuniting children with families and doing deinstitutionalization, and it becomes the only thing that's being done. And I believe that's dangerous as well. And so I wanted to put this in front of you as a caution. If the finances aren't there, if all of the different ministries or departments, health, education, child protection, et cetera, aren't working together, a lot of this social change that is happening around the world can go very wrong. Now, with programs like what I'm going to present to you soon, well, now, there are ways that things can go right and be done in such an organized way that if children are headed towards a negative outcome, you can correct that course and move forward. And this is the main point of my time with you today, is to present this model and then talk through questions that people might have. So the model that I'm presenting, that I've got full permission to present, is by an organization called Hope and Homes for Children. It's one of a number of models out there that are doing family reunification and reintegration. I found it to be a really solid model, and that's why I took permission to present it. You can see some links there on the bottom. Okay, now here we go. This is the real practice stuff. So in a general community, there are 5 buckets of different ways that you can kind of influence and alter a family's life. And you can see those on the left side. They're fairly large buckets, but I think they're pretty much no-brainers. You can kind of understand. You've got, what are the family's living conditions? What are their family and social relationships, their physical and mental health, education, and their household economy? All pivotal things that if you're not accounting for any one of those things, you might not sustainably help a family. So the first bucket there, so let's now do a thought example. Please think of a family that you believe is in a difficult situation and how you might help them using this model. So I'll give you just a split second. Please imagine a family that you'd like to work with that you believe you can apply to this model. So the first thing you would do is you would look into that community of what is the standard of living? What are those living conditions? For example, if it's a family in rural India, I can't demand that they've got urban living conditions right away. That's not sustainable. What is the living condition of that community that is safe? What are the family and social relationships? What are the cultural nuances? All those pieces. What are the physical and mental health types of standards within that community? What are the educational standards and the economy standards? So once you understand all those things about a family, a lot of social workers have the issue that they try to address all of them right away. And that's the tough thing, because a lot of times a social worker has 5, 10, 20, 30 cases at a time. Your heart, everything you want to do is to address all of those pieces. But how can you when you're working with that many families at a time? So then it's really important then, once you understand those buckets of what the community has as standards, then you overlay what that family's individual circumstances are and what their needs are, and you've got to prioritize those needs. If they can't eat one day, that's the biggest thing before. Then after that, you have a cluster of how you take those needs and put them together. Because if you try to address household economy, health, and everything all separately with 20 line items that you've figured out, it might be really difficult, and those resources might not even exist where you're trying to work. So how can you realistically cluster those needs, overlay the interventions you're planning, maybe not what you're doing, but the other services that exist combined with what you're doing, and package them into services? So this visual has helped me a lot kind of hone down what needs to be done. Now, let's do a thought experiment. So this is for a Rwandan family that's pretty rural with some pretty significant needs. I'm going to take the living conditions top line and talk it through, but all of that I think is pretty fantastic. So basically what you would do is you'd first look at what type of outcomes you want. So this family is living in a destroyed home. Their home is destroyed. They're living in their neighbor's home, which is a single room, thatched roof that's leaking, and they have no access to water or toilet. It's pretty extreme. So the first thing you do is you say, okay, what are the outcomes? And this is worded so brilliantly, I think. Family lives in appropriate living conditions at community standard and has access to local services. So it's fairly broad. But what you're doing is you're saying, we're going to make sure this family just fits the standard of their community. If you set them up for a non-sustainable standard, it actually puts them aside from their community. So it's a very important piece to understand. So then we shift over those outcomes to the left, and then we take a look at what are the indicators. So then this is a very important piece of social work that we don't do as much. How do you know you've got a win? How do you know you've been successful on the way? And how does that family know that they've been successful? If you come to the family's door and say, we've got this outcome for you, and we're gonna get you there, and you show up magically after 6 months, they haven't felt any progress. And most likely their buy-in is not there with what you're doing. But instead here you have indicators that you can check boxes along the way. So you're looking for them to have a dry, secure 2-roomed house, a toilet and kitchen, basic furniture, legal documents, and you're looking at their feeling, that they feel safe and they're recognized by the neighbors in the wider community. All of those things you can walk through with a family that you are, say, reuniting. So you all, I hope, are kind of picturing a family that you're working with. What I'm picturing is we've got 2 kids that we want to reunite with the family, and I'm doing all this work with that family in order to get them ready for not just reunification, but reintegration. So then I can talk to that family all along and say, my goal is that you're feeling safe, but right now, you know that when it rains tomorrow night, it's going to be leaking and you might get sick or whatever it looks like. And my goal is that that feels different in 3 months from now. And then you can check me in 3 months and see if it does feel different. So then we put the outcomes over to the right because that's our main end goal. And we look at exactly what are the needs. So we can bring the family along. The house needs to be rebuilt. Maybe they've got 2 teenagers at home. So you start rebuilding and maybe we find a donor or they find a community pool of money, whatever it looks like, to get the materials to do something. Also, you look at the legal aspects. You look at all those different gamuts of things. You know, if they don't have the property rights to their home, they might think every day something could happen and they could be kicked out of their home. And then lastly, you just build your interventions. And so then you say, okay, we're going to do A, B, C, and D in this timeline, and we're going to move forward. Now, all of that culminates in this. I'm getting close to my kind of takeaway message here because that is the model presented in 10 minutes. But this big piece here is that when you start working to reunify or reintegrate children with families, your goal should be stepping away from day one, which is kind of a scary message to give to a family. So if we go back to the example I was saying, I've got 2 kids, I need to reunify them with a family. I've gone to the family and I've said, okay, you all are not ready to have these kids yet, but that's your right and that's the best thing for these kids to come back to you. Let's work on A, B, C, and D. But the day I start working with you, I'm going to be planning to step out of working with you. And that's scary to some people. But the idea is that it's not sustainable for us as social workers to carry a family forever or to carry a community forever. So what this shows you is that in an extreme circumstance, you might say, okay, this family needs this right away, and we're going to work with them intensively. So maybe I'm a case manager and I'm spending 20% of my time or 30% of my time with one family if I can via whatever program I'm doing. And then I'm saying to that family, you're in extreme need right now, but you are not going to have 30 or 40 or 20% of my time moving forward. I'm going to have to step away. But as I step away, my goal is that you are feeling more and more confident every day to take the baton and move forward so that when these 2 children come back and live with you, you all are set up for success. Because the most heartbreaking thing we can see is those children come back to you and then boom, 3 or 4 days later, you feel like you can't manage them or the authorities have to come in and remove those children from your home or whatever it looks like. And so if you look at this trajectory here, you've got urgent interventions, then you've got these more specific tailored interventions where you can step back a little bit and say, okay, here's the game plan for 6 months or for 9 months. And then you'll eventually get the family to ready to exit the program, but not to have them exit right away. Because if you have a family exit right away when you say, okay, you're ready to go, then they're still kind of reeling a little bit But instead you say, you're ready to go. Now let's make sure you're helping the next cohort that comes in. And maybe you create focus groups and maybe they can support others, depending on confidentiality and everything else. But you invest them into the plan moving forward. And then there should always be a lifeline moving forward or an emergency lever that they could pull should they need some support or just a little dose of hope. So this gives you a broad overview of what I was excited to present. Now, I'm going to transition to a story of success. So the story of success here is that when all of this is done correctly, a majority of the cases, you're going to see a child into a sustainable family. So this photo is put up here with permission, with consent, and the name has been changed. But we're talking about this young woman, Zoya, and her sibling, who were removed from their family by the authorities due to a number of pieces of neglect. So it had food issues and all those different things. And again, this, sorry, I didn't mention this is in Moldova. So when those children were removed, the SIRI team in this case went in and started working with the mother and the family and the father and some of the existing family members to make sure that they were getting the services they need. And you can see in blue there all of the different types of treatment that were wrapped around to this family. And as those pieces of treatment were given to this family, they were able to stand up on their own 2 feet, slowly but surely. And the children then were reintegrated. And now 2 years later, this happened 2+ years ago, when you visit that home, it's a safe, stable environment that is at the same level as the others around them in the community. The young woman and her sibling have been empowered to be able to kind of report and have their spidey senses go up when something's not right. They know they have somebody to call. And the family, extended family around, knows how to support that mother and father as well. So it's a concentrated effort. So in kind of concluding everything here, I've got another about 4 or 5 minutes before I kind of hand it over for questions and answers. Starting with the United Nations Convention on the Rights of the Child and moving forward in the past 3 decades, the entire globe has been moving towards this idea of deinstitutionalization. And as part of deinstitutionalization, getting children out of orphanages, especially huge orphanage setups, and into family-based care. There have been varying levels of it being done around the globe. There's work currently in Africa, in Asia, everywhere you can think of, Latin and South America, in Eastern Europe, etc., of countries and states and regions deinstitutionalizing. But the research is just beginning to come out. The European Union did a huge project for, I think it was a decade, I can't remember the exact amount of years, called Opening Doors, which was opening the doors of institutions. And in all of this, the learning is just beginning to be publicly disseminated. But the cautions are all there in the way that I started, is that if you pick up 2 children, you put them into their family and haven't changed anything and are not giving sustainable support, unfortunately, everyone is set up for failure. And so to end up my presentation, I wanted to kind of prompt you all and ask for kind of a public discussion on how you've seen this type of reintegration work well or not, and what questions you have when you think about putting this into direct practice. Because my hope is you as a practitioner take away from this, okay, I think we could have been a little more organized in supporting our family moving forward. Or we could have helped our case managers or helped teachers or helped healthcare professionals understand a little bit better what we were doing so that the services could have been coordinated better. So I could go on, but I'm right close to the 30 minutes that I planned on doing. I'd love to open it up to questions, or Gary and Janet, however you think this should move forward. And then I've got a ton of material and could come back in should I need to in regard to a more formal bit.
That was really a fantastic overview and a lot of really substantive content there. And there have been a number of questions that have been popping up in the chat box. But one thing I wanted to ask before we dive in there is that have you found that this this approach has reduced attrition rates in terms of like families participating?
Can you clarify a little bit in regard to families participating in the program itself?
Yes, that's right.
Yeah, absolutely. I mean, so let's take a community, for example. So say I worked in Udaipur in the state of Rajasthan in India for quite some time with the foster care organization. And we worked with a number of different families and stood them up with regard to these types of services. And what we would find is that those family members, after a while, were referring out to other people coming in to the program itself. And then slowly but surely, they would move out and they would support other family members in the community.
Excellent. I'm going to jump to a really wonderful question here. It says, have you seen this model translate effectively or not in cases of reintegrating and reunifying kids with a parent who has previously been incarcerated, perhaps in high conflict custody situations or in situations where the child has experienced abuse from one or both parents?
Absolutely brilliant question. Thank you so much. So it depends, of course, of the legalities and how heinous that crime was. I mentioned in the very beginning, the fundamental denominator out of all of this is the child's best interest. So sometimes it's determined that it is not safe for that child to be reintegrated with their mother and father. And so then at that point, part of this program as well is saying, okay, if mother and father are not appropriate, they need to be distanced from that mother and father, but maybe a removed family member that is a safe place or a community member is a safe place. So there is that next step. Because we've seen many times people do it wrong, so to speak, where they say the mother and father deserve to have that child no matter what. Well, no, if it's not in that child's best interest, then that argument has to be made logically and safely with everybody's rights being intact, but then looking at the other options, moving different layers out.
Here's another really interesting question from Bina. She asks, we have families that have complied with their written service agreement and are ready for unification, but Children's Division and or the court does not want them to move towards reunification. How can we address this issue? A very interesting tension between institutions and the actual caseworker, social worker.
Absolutely brilliant. So it speaks a lot to this feeling of the apple doesn't fall far from the tree. The idea that if a family has made some mistakes, they've made some mistakes and they don't deserve their children. So one thing that we've done in the US iterations of the work is that we've run into a number around the US, a number of judges or a number of Children's Division officials and a number of 501c3 not-for-profit workers or administrators who have said, sorry, that family does not deserve that child. And so what we do is kind of, you have to put the information in front of them to kind of help them understand, okay, so this is the reason that we're doing this. These are the services that we've put in place for the child. And here is kind of the proof behind what we've done. We've done it with ABC other family, or we've seen it happen with ABC other family, and these have been the results. And these are the consequences should we not do this. Now, the issue is that sometimes a case manager doesn't have time to put that in front of a court official. And so that's where you influence your organization to have stakeholder meetings and to kind of move the entire mindset of the area. So say, for example, we're in St. Louis County in the state of Missouri in America. We would bring together court officials, et cetera, leveraging a number of not-for-profit organizations and say, we just want to expose you to this concept. And we do something like put that fail case study in front of them as the first thing. and say, argue back, put your question of the apple doesn't fall far from the tree in front of us. And then let's talk it out. And let's look at the evidence that's saying, yes, there are huge benefits from doing this, but we are going to have some cases that are difficult. And then that system can take a look at their risks and their benefits, and everybody can move forward together. Sorry, very long-winded answer.
No, not at all, actually. And it's inspiring a lot of questions. They are just flying into this chat box at a rate that I have not seen at these
That's great.
Open classrooms. Here's an interesting one. How do you address situations where the compromised situation the child is in is due to the community or community pressures?
Oh, brilliant. So I'm trying to think of an example, but I would kind of feel like maybe, so this is an extreme example, but I can think of a lot of children I've worked with in red light districts, and those children, because of their community, are being pushed into sex work. And so that's, again, it's a best interest question. We don't want to remove that child completely from their parent, but maybe they need to be physically away for a little bit in a foster situation, with another relative, with another community member, while still continuing that connection while we work with the parent. So for example, I can think of some work in Calcutta, India, where we had 2 girls living with a single mother in a red light district area. Those girls couldn't stay there because the community pressures were too much, but they loved their mother and their mother loved them. And so they ended up living with a former sex worker who was no longer doing that work and living outside of the community. Their mother would come visit them often, and we worked with the mother to see if she could gain some vocational skills so that she had a source of income to sustain herself. And it took a number of years, but that was a solution that was very clear. And actually the local government and authorities could kind of see how we were moving towards.
And on the other end of the spectrum, it says, what is the process when a family is not open to engaging in services or is not interested in reunification?
Oh my gosh, it's such an opportunity, right? So there's a reason for that. And so that's the thing where so many people, especially if you've got 30 cases on your caseload, you're like, I tried. We ticked the box. I contacted grandma. Grandma's not interested. That's it. But we found so many times they said no because they were worried about the drama that mom and dad would bring in. Or they were worried about, I work nights and I don't know how to take care of this kid. So maybe it's a mother, father. Let's go back to this example of these 2 kids that I was talking about. We want to have those 2 kids go back with mom and dad. We contact mom and dad and look, we can't do it. But they don't volunteer the information of why. But all I have to do is say, mom and dad, I totally get it. I kind of feel like you love your kids. What's going on? What is the reason? And maybe mom and dad say, we're just not making ends meet and we're working at night and we can't take care of the kids. And then I say, that's all right. Who else in your family circle is around? And they say, well, my brother stops by all the time. And I contact the kid's uncle and I say, could you take the kids at night? And they're like, absolutely, we're home, fine. The parents all of a sudden take a deep breath. We've coordinated services and actually strengthened their safety net. And we come up with plan B, C, and D.
In your experience, what have been the biggest gaps in implementation? Has it been finance, infrastructure, professional social work, workforce, government buy-in? Like, where are your biggest hurdles?
Yeah, yes, and yes. So the biggest hurdle is the coordination of all those things and helping people who usually don't play nice in the sandbox come together at one table. However, the front end piece of that is people coming together and creating such clear plans that all of those various pieces of the puzzle can understand where you're headed. So what happens is a lot of times, so let's take a country level. Say a country says, we want to move towards reintegrating children with families more. They bring in a consultant and they create some 60, 70, 100-page document that's this really tough rubric, log frame, whatever they're called, and hand it to all of the bodies of people that are supposed to do this stuff. They don't get it. They can't interact with that. And it only goes to administrators. It doesn't go to caseworkers and the people that actually have to buy into doing this work. Instead, if you take that information in the plan and you create a couple really awesome graphics and maybe a video and things like that, and you have a whole dissemination plan where you say, dear orphanage worker, you've been working for 14 years every day to keep these kids safe, and you haven't done a thing wrong. You've put your heart into it. This is a new iteration moving forward, and here's the reasons we're doing it, and here's a forum where you can voice your concerns. Or, dear administrator, you have been reimbursed by the government for 12 years to provide this residential care. Now, I believe that you're worried about how you're going to keep your doors open and how you're going to keep your staff paid. So here's your part of the plan. We are looking at changing the financial pieces. Or, dear financial body, here's how we've seen other countries reallocate their funds so that they don't lose out and they don't have to have some huge, big increase in budget allocations. So all those things together, but it's about communication and collaboration.
Yeah. So Carol says she loves the model and wonders what happens when resources are needed and they're either unavailable, like safe, affordable housing, or have long wait times to access them, mental health, drug treatments, and children end up kind of lingering in the system. Any ideas on how to work effectively with families in these circumstances?
Oh gosh, absolutely. So let me give you a real-time example from here in the US. So we're thinking about scoping a project in Cape Girardeau, which is in the south of Missouri, in a fairly rural area. It itself isn't rural, but there's another couple counties near it, Perry and Bollinger, and different areas. They're fairly rural. So in working with families in that area, internet's a problem and transportation's a problem and all of these different pieces. So sometimes you cannot move that family through the treatment plan you would ideally like to do with them. And so the first thing is being just straight up realistic. Looking at what neighbors are accessing, looking at their standard of living and saying, we are not trying to put you below the standard of living of those around you, but these people that you are living amongst are having the same struggles. And so we know that it's tough. We know you want to do better for your children, but the bigger deal is that your children are with you when it's in their best interest, your best interest, and it's safe. The other thing is bringing people together, organizations and government, to understand truly what those gaps in services and actually advocate for those to change. So taking that same example, we bring together all of the awesome players in the field who are working in those areas and create an advocacy engine and voice towards the state government of Missouri and say, these are the issues. You might not see change right away, but it will be something that you're moving towards, and you can involve those families. So when the families are having a tough night, they have no access to internet, COVID-19's happened, they've got 3 kids that are trying to study online and one little hotspot Verizon thingy and nothing's working, they can know that when they call you, you can say, yep, that is a horrible situation and you should cry for a little while. But we are working hard on this and your voice is imperative to change moving forward.
Yeah. Ian, we have more questions coming in than we're really going to be able to answer today, which is just a tribute to our participants seeing you as an amazing resource. I'm going to read this next question, and then Janet, I know you've been kind of surveying them as they're coming in. I'll hand you over to for the next one. It says, Brandon says, I work for an NGO that supports nonprofits that are transitioning to family-based care.
Nice.
And there are a number of governments, such as Kenya and Malawi, that have issued guidelines for residential care facilities to reintegrate children suddenly due to COVID-19 and social distancing without adequate preparation measures. Are you aware of resources or have any insights for such an environment of rapid, large-scale reintegration?
Well, thank you so much for asking. So UNICEF has put together a couple things. The Better Care Network has an amazing thing. So please email me afterwards or anyone and we'll get those resources available. To be honest with you, it takes infusion of casework to manage that. So I've seen that across the board as well. Even in India, there's been a lot of calls all around the world. There's been calls of, we see it in our incarceration in prison right now in the US as well, right? Get people out of the institutional setup and get them back into the community. But if you're not fixing the thing within the community, you're also facing fairly grave consequences. And the only solution to that is whatever interventions you're doing is to pivot and case manage and find those families, because sometimes all those families need when the kid is dropped off is a call that says, this kid's coming back or has just been dropped off on your doorstep. Did anyone tell you what's been going on with the kid? Just so you know, they've been waking up every day at 5 a.m. They've been having this type of food. Their new favorite color is this, et cetera, et cetera. And as you're transitioning with this kid, just give us a call if you're in crisis, because we know it's going to be tough. That's where the intervention can come.
Great. So many good questions and positive comments coming through regarding the model and meeting people where they are, as they are, and helping to move forward. And we have a question about if you have a situation where children have been in an institutional setting for years, like an orphanage, for quite a period of time, and the family is not ready now. Based on your model, based on your experience, do you favor more of a gradual approach where you're getting the kid out of the institution but into a foster family, and kind of a longer time horizon on possible reintegration and reunification, or really scale up the support to that family first?
Well, really, that all comes down to best interest determination. There will be some kids, and that's where the child, depending on their developmental level, age or capability-wise, needs to be part of the conversation. So I could imagine, a 14-year-old girl that says, I know they're not ready, but all I want to do is be with my family right now, and that's all that's important to me. So we're going to just flood their family with services, and we're not going to push them so far that it's not realistic, but that's where the investment goes. Or maybe you find a 14-year-old boy that says, I'm kind of happy with my friends. I really do know that I want to go with my family. I get it. I don't hate them. But then you slowly and gradually figure something out. It really is on what is best for that child and family. And that's why we need systems that begin to be more case specific.
Sounds good. We've also had several questions that get to policies that need to be in place for this model to be as successful as possible. So I'm conflating several questions from Susanna, from Emily, but really just asking your thoughts on sort of different jurisdictions, nationally, state, what can be done at the county level, the intersection of policy with supporting this model.
Great. So I'm going to give you an India example and then transition over to an American example. So in India, there, as part of this thing called the Juvenile Justice Care and Protection Act, there are different ways of caring and protecting children, but one of them is sponsorship. And sponsorship is certain amounts of money or support going to keep a family together or to reunify or reintegrate a child with their family. The umbrella legislation has guidelines at the national level, and then each state or union territory in India has to turn that policy into what works for their population. Then from the state, you have to get down to the district level where they need to actually enact it and actually reach out and support families. So if you talk about now in the US, when you're looking at county level, city levels, depending on whether your state is a county-based system or not, it takes a up-down, both approach of the state needs to say, okay, this is what we're doing in regard to reunifying families. We've looked at the Families First Act that was passed in 2018. We've now looked at the COVID-19 iterations. We've now looked at the transition time for the next 2 years. And what we're doing is we're saying our state's going to do A, B, C, and D, and this is where we're going to put our money. But then the counties and city levels have to then react to that and say, okay, we're going to pilot it here. We're going to do this iteration, et cetera, because every county area functions differently, especially those that are more autonomous. And so in regard to policy, and you know, I'm lucky enough to teach a services and policy class right now at the Brown School. We always talk about the fact that you need all of the voices. The states need to be able to interpret and let the ground know this is where we'd like to head with this. And the ground needs to say, but this is what we're seeing on the ground. And there needs to be a navigator or a mediator that is promoting those conversations. And that's what maybe some of you could do, is help to get those conversations back and forth using actual practice examples.
Great. So Andrea actually had a question specifically related to Families First Act, and so since you mentioned that, I'm going to say that's a timely segue. She mentions the focus on prevention within that act, and wants comment on how do we use prevention as an intervention.
Oh gosh, well, it's wonderful. So basically what the idea is that your catchment no longer becomes, it doesn't get activated when a child enters the system. It gets activated when a family's at risk. It kind of seems like it just makes sense. Like actually the return on investment of helping a family at risk de-escalate and come back to stability is so much less than the child being removed from the home and then working to reintegrate or reunify them. So prevention in and of itself is an intervention. The entry point is that you have to be actually looking differently. You have to actually be out in the community measuring and finding those families that are at risk for separation. You need public awareness events that say, is there, you know, a crisis going on in your house? Call this, because we don't want you to get to the point where your child, some caseworker has to show up and ask to remove your child.
A question from Joan on supporting non-offending parents. If we have a situation where the child has been removed for abuse, but abuse is only alleged against one parent, there's another parent also caught in a very challenging situation, possibly wanting to leave that challenging situation. Do you have any resources or commentary on supporting a non-offending parent?
Yeah, I mean, of course there are resources out there, but that's based in family counseling and helping that person be safe and remove themselves from the situation should that be determined as the best route for them. It could be that you're working with the offending parent and maybe you're just seeing no progress, and that non-offending parent is like, I just want my kid and that's it. And there are organizations out there that are working specifically with, if it is a woman, for example, working with them, or men and fathers working with them, etc. It's finding the service that's catered to that situation. And I know that was somewhat of a non-answer, but I don't know how to do better.
That's fair. Gary, do you have notes on any other questions that are in queue?
There's a interesting and rather complex question about someone who has a JD in addition to having an MSW, and finds that they are sometimes on the other side of the court from a caseworker or social worker who should ideally be using this method, and is asking, how would you suggest communicating with clients who are at odds with their caseworker or social worker due to value judgments, perceived or actual, or with caseworkers or social workers who are making these judgments or are unaware or not open to understanding how their actions are being perceived?
Yeah, I mean, so obviously it's sometimes politicized. It's sometimes where you can't make a comment right there in the middle of, say, a team decision-making meeting or some sort of court kind of iteration. But I believe, at least this is just my gut reaction and my personal opinion, it is approaching that caseworker first and foremost. If that caseworker is not hearing you or not understanding due to value, judgment, whatever it looks like, it's then approaching that person's supervisor, if you can determine them or get to them, or approaching somebody another level of influence. And if that doesn't work, then you start screaming from the rooftops. Now, I understand that sometimes that's not safe politically, but what I believe is that that's part of our duty as a social worker, is to elevate those things in a safe but also respectful way. Go to that case manager first. We don't do that enough. And say, I'm not trying to offend you, but this is how I read that situation, and I want to talk about it. And just so you know, and it's important to say this, if this doesn't resolve, I feel it on myself to take it one step up, and I'm just going to let you know that's what I'm going to do.
Sorry. So we have just a few minutes left. Did you have some closing comments you wanted to share with folks, and then, you know, and possibly restate your offer of accessibility so folks can follow up with you if they need to?
Yeah, I mean, I've got my email at the bottom of each slide. I am unbelievably grateful for all of your time in listening to this, asking questions, and would love to continue a dialogue with you. And I'm so grateful to the Brown School for allowing kind of this platform that we can all come together and think through these things. And I hope that what I'd ask everyone that is here listening is if you would have one meaningful conversation about this with somebody else today or tomorrow.
Yeah.
And that would just be a wonderful way for this to spider web out.
Wonderful. Well, thank you, Ian. I know all of our attendees are thrilled, and I'm just so very grateful for your time and your expertise. And I have no doubt that we're going to get some emails asking for another chance to hear from you. So know that that's probably on the way. And Janet, any closing thoughts from you as we say goodbye to our participants?
Yes, absolutely. Thanks everybody for joining us. Thanks Ian for really an inspiring and informative presentation. We will be sharing these slides, which are, as you pointed out, just dense with information. So this is a tool that will be available to you. We'll also be inviting you to the event that Gary talked about right before we started, related to early childhood education, and encourage your participation in that. We are continuing this series. On Tuesday, we will be joined by Professor Veto Sanders-Thompson, who's going to be talking about class, that's cultural linguistic appropriate standards, and health equity, which is certainly very timely right now as we're watching incredibly disturbing demographics around COVID-19. So please do join us. Still time to register on Tuesday. And we continue to add to this series based on your interests. We're continuing to roll with new programming. So if you haven't been to our website recently, please do see what we have on offer through the month of May and now into early June. We certainly would love to have your continued participation. So with that, thank you for joining us. We wish you healthy and safe and hope to see you again soon in Open Classroom. Thanks, everybody.